Hi everyone, I hope you are enjoying early spring and everything is blossoming where you are. Hopefully it doesn't affect any allergies or any of the vestibular systems. So I'm hoping you're enjoying as much as I am. The warmness in the Midwest is finally is warming up and I'm able to take all the layers off a little bit. Still having some light layers here and there, but it makes it a lot more manageable to continue on with your day. So I wanted to give a little bit of a quick summary of where I am now. And I also wanted to give you a perspective on an experience that I just went through. I am in month 15th. I wanted to just follow up on my other video that I had just uploaded and saying that most of the symptoms that I've shared have not changed, pretty much the same ongoing issues, and have really good successes and still have some struggles to overcome. With anything else, everything can be a little bit of a challenge with long COVID and just vestibular disorders in general. I wanted to take us back a little bit into a decision that I made 6 months ago. 6 months ago, actually, I wasn't as recuperated as I am now. And looking back, I definitely health anxiety takes over you and you just become very desperate in trying to figure out what the next step could be, what is the next treatment, what could potentially aid in the recovery process. So within, I would say 8 months into my recovery, I was kind of feeling a little bit, I would say, maybe down, depressed, or just frustrated with the lack of just the lack of way out. I didn't see anything else that could potentially help me or aid me, and I started researching a lot and trying to see what other treatments would be available for me. And one of those is prolotherapy. On the other one was a kind of like a very intensive VRT brain treatment, and I went to research a little bit around those types of centers because they were really marketing around long COVID and vestibular disorders. So I thought perhaps they would help me in bridging the gap of what I thought potentially would need resolving. So I had that conversation with some of the centers. I decided that one of the centers was really speaking more my language. I got along more with the salesperson. Some of the questions that I had were answered thoroughly. I didn't feel like I was being taken advantage of it. So I decided to go ahead and make plans with plasticity centers, specifically this Plasticity Center really had some knowledge or at least some experience with long COVID patients, or so they have obviously stated. And so I put down the down payment for this Plasticity Center, and I kind of remained very positive for this treatment plan. And time passed, and actually because of other things that came about and health issues and other personal issues that would come about, I kept kind of like extending it, and finally, like, I had to do something about it because I already had to put a major chunk of the down payment in. So needless to say, I wanted to share a little bit of that experience. So, what is Plasticity Center? Plasticity Center, you can YouTube it, you can Google it. There's not a lot of like experiences out there that I could really relate to in terms of people with long COVID or with vestibular disorders. Most of the people that I looked at in terms of their experience were regarding cognitive behaviors in our brain disorders, such as ADHD, autism, or any of those spectrums. So when I was looking at it, I really tried to make sure that I was vocalized about specifically my needs and what I was needing from them. So this week, actually, I came back from the Plasticity Centers, and I wanted to do kind of a raw review of what I experienced in hopes in sharing my experience, and maybe it would aid a little bit to others to make a final decision if you're looking at something like this or a very similar program. So it is a 1 week intensive treatment from what the sales representative told me, and from what I gathered from what their website kind of shows a mock intensive week. It would be a lot of treatment for a full day. We'd have some downtime here and there, but most of it would be really trying to hone in specifics on what potentially could be the factor of the underlying root cause of your issues, which it was like that. They did a really good job, I think, of the expectations. Mind you, I went in with a very apprehensive, open mind, which, with a lot of the treatments that I've done already, I think that most of the treatments that really have aided me the most were really just prioritizing mental health, the health initiative in terms of food, in terms of sleep, so the basics of what makes you you. And those are kind of the building blocks of health. So I went in open mind, just trying to make sure that I learned and took the best of the experience. I would say that the first day is a diagnostic day, so they kind of put you through a lot of the vestibular testing that I had done already. So VNG type of assessment, a lot of kind of VRT type assessments. If you have done rounds of VRT, you know exactly kind of what type of diagnostics they utilize, with goggles, with screens, with some foam. They use a little bit more of fancier equipment that I hadn't seen before, but the utilization or the diagnostic result was very similar to what other providers had given me. And I actually tried to not share as much with them in terms of the diagnostics that I had done, in hopes that maybe they would find something new, or actually I just wanted to kind of calibrate with them as to what they found as well. No surprise, and I was actually pleasantly surprised with this. They did not find any like specific factors that would have been missed by any of the other providers. In fact, most of it was very similar to all the other providers. None of it was something that was new to me. And for some people that might be kind of a little bit heartbreaking to be like, well, I didn't learn anything else. There's nothing else they can give me, or there's no other diagnostic that could provide some aid for my symptoms. But for me, I took it as confirmation of like, okay, I have gone through all these providers. I had set this specific provider and treatment up, 6-7 months ago. I had postponed for different reasons. And now that I am here, I am confirming that nothing has been missed. Everything that I have potentially been looking for is there. It was really nice also to see objectively some of the findings. I think with some of the other vestibular providers or any other neurological providers have been that they give you a report, and you have to kind of deduce their findings, or they have to sort of interpret those results to you. What I really liked about the center is that they really kind of gave you the raw data and walked you through it. It was really nice to see some of those specifics. For example, I've done 2 VGN tests before, which is the visual stimuli, and I've had those, reports stated to me, translated to me, and we've kind of reviewed those together with those providers. But I've never really seen my actual eye movements or tracking mechanisms. And here I was able to see them in like pretty much live. Um, right afterwards, they were able to show me, this is where, your left eye will not track correctly. This is where your right eye may go in a different direction. And I was kind of thankful that I was able to see that. It is sort of a good satisfaction to be able to see it objectively and find those findings and say, okay, there is something that biologically is wrong within my vision, within my vestibular system, and it's not all up in my head. I'm not making it up, as potentially some providers have made me feel at times. But that objectively, biologically, there is something amiss. It was really nice to get that confirmation. Obviously, there was no new findings that they found. And the remainder of the week was pretty much trying to come up with a treatment plan specifically for me around those findings. A lot of the treatment plan, I would say 90% of the treatment plan, was a lot of tried mechanisms where I have tried those already, and for whatever reason, either I have tried it and I think that that is the most usefulness that I can receive from them, or they haven't worked. And they were really open about me sharing, like, hey, I've done these types of treatment plans, and this, for some reason didn't work, or this specific one aided, but there's like maybe a gap that's still missing. I really did like that the provider on hand was very well versed in the vestibular system. I think some of the reviews that I read online was that, some of the providers within these centers don't have perhaps the knowledge or the schooling of a doctor. I disagree in the terms of my experience and the provider that I had. I don't think that a title of a doctor would really aid as long as you have a certification of the vestibular system and protocols on how to help with such disorders, which this provider did have. I actually looked up licensing requirements when I was researching this specific center and their provider. So I felt quite comfortable. Actually, the provider that saw me specifically and I worked with had pretty much the same accreditations and licenses as the vestibular therapists that I've worked with. So I felt quite comfortable in their knowledge and didn't feel at all that they were quote unquote making anything up. In fact, a lot of it was again a good reminder of some of the VRT protocols that I probably have left a little bit to go to waste, and it was a good reminder to utilize those. I did gain some great protocols and techniques that nobody has ever shared with me, either because maybe their knowledge wasn't there, or maybe because this center is so niche that they were able to redefine or define some of those protocols for me. Again, 90% of that knowledge I had already seen, heard, done, or had some sort of knowledge of, so it wasn't really quite anything new. There is a 10% that I would have learned a little bit of new information or new protocols or new techniques that I will incorporate into every day. Obviously, with the price tag, it comes with not only a 1 week intensive stay, but also a home protocol that will continue for the next several months. I wanted to share my experience because I think as long COVID and vestibular patient, a lot of the times our diagnoses are so wishy-washy because we don't have really good providers that really understand the biological markers or where to look for those biological markers. And there are other providers out there that state that it is very psychologically induced, or that perhaps every something traumatic has happened in your life where this will perpetuate some of the feelings of symptoms. And I think everything has its place, its timing, and its own self of being, and all of it has a little bit of truth within. But I really think that you have to know your body, and you have to understand um, where your body feels that is not right. And only you and your persona can really understand your body. You know yourself the best because you have been within your body since you were born. So you understand what feels right and what feels wrong. And I think regardless of the potential outcome on this, what I really learned from this is to really advocate for myself. And I've been really learning this over and over, and really understand that when something is biologically wrong, that there is potentially some markers of biologically um, factors that may be interfering with a potential getting better or resolution of symptoms. And I think that is something that gets really frustrating and can be, well, not only detrimental to mental health, but really be a factor to bad mental health and potentially good outcomes, is because as a long COVID patient or as a vestibular patient, I can assure you that a lot of the times I have tried to say there has to be something wrong with me. There cannot not be nothing wrong with me, even if labs, even if other markers say differently, because I don't feel right and I was not like this before. And finding that needle in that haystack can be very, very overwhelming. It really depletes you emotionally and physically, because you may not find that needle in the haystack. Maybe there is potentially all the biological markers have completely resolved and there's nothing there. But for me, I just felt like there had to be something that they were missing, I was missing, or that I wasn't comprehending enough. And I think that regardless of that experience, I think the end result for me going through this experience with the center was coming to the resolution that yes, there was something biologically wrong. Obviously had labyrinthitis. Per the data that many providers use, they may say that my labyrinthitis has resolved due to potential gaining of ear loss or hearing loss or any hypofunctionality. And because they don't see that objectively in these findings, does not mean that there's nothing biologically wrong. In fact, I was able to see it myself. I was able to see my eyes not track. And I don't think that, this provider made it up. It was, can I track this or I cannot? It's a very black and white sort of objective finding. And for me to see it on screen, black and white, see the tracking of my eyes, and how they do not track correctly, was a validation, I guess, that I needed. And so what do I do with that information going forward? Well, obviously, I think that, and this is where I have a little bit of, push and pull, is because I've done 6 months of VRT, and most of the treatment plan that this center has provided is very VRT-like. Obviously, they sell it under the umbrella of functional neurology, but functional neurology is VRT. If you really look at the definitions of it and how the treatment protocol looks on any VRT, you will see that that is what it is. Um, and it's kind of a good reminder for me to go back to the basics. I think after a while of gaining a lot of successes, I did forget a little bit of going back to basics in terms of the neurological aspects of things. I think I had prioritized health, I had prioritized my body, but I really hadn't prioritized the cognitiveness factors, the neurological factors, the eyesight factors that are still there. Yes, I am pretty much running on normal. Yes, I'm pretty much back to normal life. But I still have challenges to overcome. I mean, I still have intermittent dizziness here and there. I still do have vision issues once in a while. And for me to have that validation moving forward does really make a difference. Now, would I have done or completed this treatment plan in a different time setting, times in my recovery? Absolutely. I think I waited too long. I think that I had gained a lot of other knowledge through other providers and through other treatment plans, and I waited too long. I think if I were to do this again, I probably would have gone when I was looking at it, which was month 6th through 8th of my recovery. I think that that would have been probably given me the push that I needed in terms of my recovery. I also think that I probably would have gone back at this time around on a second trip, but I think I did wait too long. The benefits didn't really outweigh the price tag of this treatment center. So if you are in your journey where you have seen a lot of providers, or if you tried a lot of treatment protocols and your long COVID doesn't get better or incrementally get better, your dizziness, you don't feel like it's getting any better either, I think that really you should maybe potentially look at basics and really start over with some of those treatment plans. So, if you have reviewed VRT with a specific treatment plan or a specific person, maybe you switching it up to another person to look at it with brand new eyes would give you a better benefit. If you have done a lot of the visual treatments or diagnostics, and you think that perhaps somebody else can review it with brand new eyes, I would suggest you doing that before going into a center where obviously it's going to be an out of pocket experience. It's going to be a higher price tag, obviously, because it is not covered by insurance. Then, if you are really early in your journey, I think potentially this could be something that would aid a lot. I think that if I would have done this again in the 6 month mark, I would have gained a lot of understanding on what was going on with my brain and with my vision, with my vestibular system in general, and would have probably gained a lot more than just the experience of the knowledge. I think I would have made much more strides within my recovery. So, this is kind of a quick review of my experience. Again, this is a personal experience, where I am in my journey, what I've done so far in terms of cognitive and neurological treatment protocols. And I really do think that if you are looking at something very similar, if you're looking at something where it'll take your time and money, you really think about it, if you are very frustrated or do not have the providers or the resources in your state, I think that this is something that you could potentially review and look into, with keeping in mind that most of the information you probably will be able to find either online or through other providers. If you are very early into your journey and you are able to afford it, you are able to, get that resource, look into it. I would say that overall, my experience was a positive one. Not all the reviews that I read were positive. The majority were, but some were obviously negative, and everybody has their own experience, so that's their truth. But I wanted to share my truth to you, just as it is. If you have any questions regarding the Plasticity Center experience or my experience overall with providers, please feel free to just jot down a question on the comments and I will try to get to them. Blessings, everyone.